Welcome to this educational video about congenital mitral stenosis. Today we'll delve into this rare heart defect, exploring its causes, how it affects the heart, symptoms, diagnosis, treatment options, and more. Join us as we uncover the intricacies of this condition to better understand its impact on individuals from birth. Congenital mitral stenosis, or CMS, isn't caused by lifestyle factors like acquired valve disease. Instead, it arises from errors during fetal development. The mitral valve, which controls blood flow between the left atrium and left ventricle, doesn't form correctly. These developmental errors can stem from genetic factors or occur spontaneously without a clear cause. While specific genetic mutations are not always identified, research suggests a complex interplay of genes may influence valve formation, and the abnormal valve structure is present at birth. Now, let's understand the mechanics of what goes wrong. In a healthy heart, the mitral valve opens wide, allowing blood to flow freely from the left atrium into the left ventricle. In congenital mitral stenosis, the valve is narrowed or obstructed. This stenosis impedes blood flow, causing a backup of blood in the left atrium. Over time, this increased pressure in the left atrium can lead to enlargement of the atrium. The elevated pressure is then transmitted back into the pulmonary veins, resulting in pulmonary hypertension. This pulmonary hypertension makes it harder for the right ventricle to pump blood to the lungs, potentially leading to right heart failure. Congenital mitral stenosis is a rare condition, accounting for a very small percentage of all congenital heart defects. Accurate prevalence rates are difficult to establish due to its rarity and the variability in severity. It is often associated with other congenital heart defects, further complicating epidemiological studies. It's important to note that CMS is not more common in any specific geographic region or demographic group. The signs and symptoms of congenital mitral stenosis can vary depending on the severity of the obstruction. Infants and young children may exhibit shortness of breath, especially during feeding or activity. They might experience fatigue, poor weight gain, and frequent respiratory infections. In more severe cases, cyanosis, a bluish discoloration of the skin, may be present. Older children might complain of chest pain, palpitations, and dizziness. Sometimes, however, mild cases of CMS may go undetected until later in life. Diagnosing congenital mitral stenosis requires a thorough cardiac evaluation. A physical exam, including listening to the heart with a stethoscope, can reveal a characteristic heart murmur. An electrocardiogram, or ECG, may show signs of left atrial enlargement. An echocardiogram, which uses ultrasound waves to create images of the heart, is the primary diagnostic tool. It can visualize the mitral valve, measure the degree of stenosis, and assess the function of the heart chambers. Cardiac catheterization, an invasive procedure, may be used in some cases to measure pressures within the heart chambers and assess the severity of the stenosis and any associated defects. Congenital mitral stenosis can be classified based on the anatomical presentation of the mitral valve and the degree of obstruction. A common form involves a parachute mitral valve, where all the chorda tendineae, the strings that support the valve leaflets, attach to a single papillary muscle. Other forms include fused or thickened valve leaflets, a short or absent mitral valve annulus, or abnormal chordal attachments. The severity of stenosis is typically classified as mild, moderate, or severe, based on the pressure gradient across the valve and the size of the mitral valve area. Treatment for congenital mitral stenosis depends on the severity of the condition and the patient's symptoms. Mild cases may only require regular monitoring with echocardiograms. For more severe cases, interventions are necessary. Options include balloon valvuloplasty, a procedure where a catheter with a balloon is inserted into the stenotic valve and inflated to widen the opening. Surgical repair, such as commissurotomy to separate fused valve leaflets, or valve replacement may be necessary. The timing of intervention is crucial, considering the individual's age, size, and the presence of other heart defects. Medical management includes medications to manage heart failure symptoms, such as diuretics and ACE inhibitors. As congenital mitral stenosis is a birth defect, there are no proven ways to prevent it from occurring. Prenatal care and genetic counseling may be beneficial for families with a history of congenital heart defects. Avoiding known teratogens, substances that can cause birth defects, during pregnancy is also recommended. The prognosis for individuals with congenital mitral stenosis varies depending on the severity of the stenosis, the presence of other heart defects, and the success of treatment. Early diagnosis and intervention can improve outcomes significantly. Long-term follow-up is essential to monitor valve function, manage any complications, and ensure optimal quality of life. Recent research is focusing on improving surgical techniques and developing less invasive interventions for valve repair and replacement. Furthermore, Studies are investigating the genetic factors involved in valve development to potentially identify preventative strategies in the future. We hope this video has provided valuable insight into congenital mitral stenosis. Thank you for watching.